The process of controlling the sphincter begins at age 2, sometimes before, sometimes after. The most important thing, while we accompany our child through this, is to respect their pace in evolution. We must notice the signals without forcing the natural process. Everyone will show physical and neurological growth on their own pace. The control of sphincter is a maturation process. It begins after leaving the baby bottle and pacifiers behind. It's an emotional and physical journey. Usually, at this moment, their vocabulary is varied. They understand instructions. They can walk, run, and maintain some balance. It's important to support them through this personal growth, not only on the action of leaving behind diapers, but on his maturation in other senses as well. It's important to provide them with some autonomy. For example, to allow them to dress by themselves, while eating, while drinking from a cup, to brush their own teeth. Even if we're present during this, we must allow them to do them on their accord. This will help them feel older and not like babies anymore. We must pay attention to some behavior that might appear. For example, the wet diaper bothers them, and they try to take it off. They ask to go to the bathroom. Even when they are wearing their diaper, they bend as if they are in the bathroom. They mention piss, pee, or poo. They imitate us. They want to go to the bathroom with us. They go 3 or 4 hours without using the diaper, which means the bladder muscles are getting stronger. Usually, sphincter control happens during the day. Once that is controlled, you can try during the night. It's recommended if we notice in the morning that their diaper is dry. We can put a cover on the mattress during this process because it's certain that it will leak during some nights. Some helpful tips for this process. Put a potty chair in the bathroom. Buy underwear together. The use of clothes that are easy to remove. Create a game where they take their doll to the bathroom. Through games, they can grow and learn. They can read stories or sing songs about the topic. Avoid giving them liquids at least 1 hour before going to bed. While they use diapers, throw the poo on the toilet with them. Never put pressure on them. This could be counterproductive. Accept the setbacks and find a way to avoid frustration and anger in them and in ourselves. And of course, celebrate the accomplishments. It's useful to create a routine. For example, going to the bathroom after eating, before going to bed. At first, we stay with them for 5 minutes. If nothing happens, we go back to what we were doing and take them back 15 minutes later. For example, each family will find a routine that works for them. There are some ways we can use during this process that can help us gradually stop the use of diapers. For example, opening and closing faucets during bath time. You can use cups, funnels, or bottles to pass water from one to the other. You can create a game with rules. For example, you fill a bottle until your child says stop, and then you reverse the roles, allowing your child to be the one to fill up the bottle until they say stop. The idea of continence is enforced with these games. The water symbolizes the pee. We must remember that this ability is acquired in a progressive manner. It's a journey that depends on each child. That's why it's important to be patient and dedicate time to be available to your child until the day when they will say on their own, "Buy diaper."
Famihood.